Hey everyone. With the COVID vaccines coming around, I think the number one question and um, a lot of the online information being shared right now, like talking about do the vaccines affect fertility or not, this is something that's on everyone's mind. And I see this every day because I'm working with fertility patients every day, 5 days a week. And so, a lot of people have asked, is there any information on whether these vaccines negatively impact fertility or not? And I want to talk to you about the first of its kind research paper that was actually published very recently. So it looked at exactly that. It looked at couples that had the full 2-dose vaccination using one of the new mRNA vaccines, and they compared IVF outcomes, comparing their first IVF, which was done before getting vaccinated, to another IVF, which was done anywhere from 1 week to 3 months after their second dose of the mRNA vaccine. So before I jump into this really cool study, I want to clarify this is not medical advice. I'm not giving advice to anyone on whether they should or should not be getting the vaccine or whether they should be taking it at a specific time relative to their fertility treatments. This is to share the results of a very exciting new study. And to answer those questions that I just mentioned, you really need to have a discussion with your fertility doctor, your fertility clinic, or your healthcare provider, your family physician. Some of the advice that's being given here in Ontario right now seems to vary a little bit just from clinic to clinic with regards to when they should be getting the vaccine relative to the IVF. But again, this is something you need to discuss with your fertility clinic and fertility doctor before, if you have any questions, before you make that decision. But just to jump into this really cool study, I think it's the first of its kind. And one of the strengths of this study is because they have the same group of patients. So we looked at IVF results right before the vaccination. They got the full 2-dose schedule, mRNA vaccine, and then they checked, were the results different in their second IVF or not. And so they compared a lot of different parameters in this study, and it was very interesting to read that. So number one, did the number of days required to stimulate follicle growth differ? It didn't. So they found that the number of days required for ovarian stimulation for IVF to get to the retrieval stage was actually similar. It was almost the same when we were looking at pre-vaccination and post-vaccination in these fertility patients going for IVF. Secondly, they found that the number of embryos retrieved was actually similar. So they didn't see a change in the number of embryos on average that were retrieved pre-vaccination and post-vaccination in these patients that again went for IVF. And then they also compared pregnancy rates. So how many patients are getting pregnant with IVF before vaccination and after vaccination. So before vaccination, of all the embryo transfers that were done in this group of patients, none of them got pregnant. And after vaccination, about 10% of the embryo transfers done led to a pregnancy. So basically what they were looking for was there a decline in the pregnancy rate or not, and that was not what they saw in this study. And one of the most important ones we're looking at, one of the most important parameters, is something called TQE, or top quality embryos, so high quality grade embryos. And this was defined by the researchers as a day 3 embryo with at least 7 or more blastomeres. All blastomeres are roughly equivalent in size, and the fragmentation rate of the embryo was less than 10%. So if it met all these criteria, it was classified as a top quality embryo. And again, there was no difference in the number of top quality embryos before the vaccine or after the 2-dose schedule for the vaccination. And so this is very exciting to see. And I should mention, we talked about the strengths of this study. One of the weaknesses of the study was very small. It only looked at 36 couples, and the patients that were included in the study had no other comorbidities. So they didn't have diabetes, they didn't have hypertension, they weren't overweight, and they had vaccinations for both partners, male and female. And they also looked at sperm parameters. So did the sperm parameters differ significantly? Because this is a huge concern patients have been having. Like, is getting the vaccine going to affect the sperm levels or not? And in this study, they found no difference between pre-vaccination and post-vaccination with regards to the number of total motile sperm. So they were doing a basic seminal fluid analysis for these patients. They weren't looking at DNA fragmentation rates or anything. So based on these results, we need to see more studies, obviously, because it's a very small study size. 36 couples is a very small sample size, and the researchers mentioned that too, that they need further research papers with larger sample sizes to verify their findings. But I think it's very exciting because it's honestly the first research paper of its kind that's actually looking at answering this question and provides valuable evidence for further research to help pick up if other clinics are finding similarities in these outcomes. And then they compared it also to how does this compare to getting COVID in general? And they published, the same group of researchers a while back, a paper looking at changes in reproductive outcomes when someone has a moderate or mild COVID infection. And that to me was more concerning in those results, because they found that post-COVID infection, patients tend to have less top quality embryos. And high quality embryos, and this is debatable, but in general, we look at high quality embryos as potentially having higher chance of success or higher chance of a positive pregnancy. And, some patients would, or some clinics would debate that now, because now they have this PGS testing, which can look for the genetic, information on the embryo and determine whether it's a high quality embryo or no. And basically they're checking for aneuploidy or whether it's a euploid embryo. And if you want to learn more about aneuploidy or euploidy, we've published videos on this on our blog post research page, so you can have a look at that as well. But with a decrease in the top quality embryo rate, basically we're seeing more embryos at higher fragmentation rates. And they mentioned how it's a 3 months prior to that ovulation or retrieval. There's a lot of complex processes at play there that determine the quality of the egg. And basically with COVID, what we see is a high amount of systemic inflammation, and that inflammation may be interfering with some of those processes and maybe impacting follicular integrity and egg quality. And same thing for sperm. They found, some studies have found that after a COVID infection, the patients that were included in the study, they had a significantly decreased amount of total motile sperm compared to patients, before COVID infection, or compared to patients that didn't have COVID-19. And this is of concern as well, because for procedures like IUI or natural conception, total motile sperm has a big impact on potential success rates. So what we're seeing in these and I want to clarify this again, they're very early studies, and there are studies also that have found no difference in sperm parameters before and after infection. So we're still learning a lot more about these, these topics. But at the bottom line, when you're going for a fertility treatment and some patients aren't able to postpone, I think these studies are very important to share with your healthcare provider, and which is why if you head to our blog post page, I've actually shared the reference for this study. And so when you speak with your healthcare provider, show them this research paper, encourage them to have a look at it and get their advice on what they would recommend for you in terms of, whether you should get the vaccine for you based on your individual case or not. And if you should, is it okay for you to get it right away, or whether you should be timing your IVF relative to the vaccination or not. But it's very exciting to see these studies, because it's giving us at least a step in the door, through the door there, to at least start having a better insight on how the infection or the vaccination may or may not affect fertility. And something I found very interesting was one of the reasons that the researchers had mentioned that they wanted to do this study was because there's so much information online right now telling people that the vaccines may affect fertility. And like I said, this is very new. There isn't actually research published on that yet. So this was the first of its kind of research paper. And I'd like to see, continuing research on that topic for all of us, for all healthcare providers and for patients as well. But have a look at the blog post, have a look at the research paper. You can download the research paper. It's actually in open access, so it's available for free. You can download the PDF version and send it to your healthcare provider, share it with them, have an open discussion and conversation with them to help you make the best decision for yourself. And again, this is not a replacement for medical advice. We're still encouraging patients to follow Ontario Public Health guidelines and follow the recommendations of your general practitioner or fertility doctor regarding your vaccination schedule. All right, everyone, take care.